Modern GP practices are no longer the individual surgeries of the past. Now they're part of a network where pharmacies, community services and other practices come together so you get the right care as quickly as possible. As a result, the NHS is improving access to appointments, particularly where a patient needs to be seen on the same day.
Same-day access is really important for our patients, and over 45% of our patients are seen within 1 or 2 days of booking that appointment. That's really important. And actually, what we want to do is improve same-day access for patients who really need it. So we get to see urgent cases quickly, and cases that are less urgent can wait a little bit longer. We're all very keen, though, to have everything done today. That's the culture and society we live in. But for us, it's really important that we prioritise patients according to their clinical need.
When you contact your GP practice and you need to be seen on the same day, you could be offered an appointment at your own surgery, another local practice or health centre, a pharmacy or an urgent treatment centre.
Every practice is part of a primary care network, which is a cluster of practices working together, usually in the same vicinity or geography. What we're hoping to be able to do is to offer more appointments on the same day through primary care networks. And that might mean, for example, that you contact your practice, but actually are offered an appointment at another practice down the road because that's where the availability is. That can also happen through 111. So you might be routed, for example, after having rung or gone online with 111 to a neighbouring practice to be seen. If it's deemed that it's really urgent, actually you might be sent to an urgent treatment centre. So we have all those facilities currently available, but we want to make that even better for patients, more streamlined and wherever possible, closer to home.
Under what's known as Pharmacy First, pharmacies are now able to prescribe medicine for some conditions without you needing an appointment at your GP practice first.
So we've got conditions like sinusitis, impetigo, which is a simple skin infection, shingles, water infections, eczema, and these are things that are really common in general practice and take up a lot of our time. But actually, if you can go into a pharmacy and not even need an appointment and get treated, including antibiotics where appropriate, that saves you time, but it also means that it's releasing capacity in general practice too.
These include sinusitis, urinary tract infections, shingles, impetigo, infected insect bites, sore throats and ear infections. The advice from the NHS is to contact your GP practice if you have an urgent health problem and use NHS 111 when your practice is closed. Through these two routes, they will arrange the right care in the right place at the right time.